Yarmouth is located at the southwestern tip of Nova Scotia on the east coast of Canada. We are approximately a 3-hour and 15-minute drive to the city of Halifax, Nova Scotia. Our region is spread out among 3 counties, Yarmouth, Shelburne, and Digby County. The regional hospital is located in Yarmouth, with 2 other smaller community hospitals, one in Shelburne and one in Digby. This is where all roads start. Hi, my name is Rebecca, and I'm the Community Navigator for the Yarmouth Region Medical Professional Recruitment Partnership. Welcome to a virtual tour of our regional hospital. This video is designed to give you a true perspective on the types of services and care that our health center provides for our serviceable community of 21,000. It's my goal to provide you with the information and connections you need to get to know our community better. Whether you're looking for recreation, arts and culture, housing, or even a how-to on getting licensed to practice in Nova Scotia, I'm your go-to central source. I moved here, raised my family here, and chose to stay in Southwest Nova. I love the smell of the sea air, the ability to walk and hike all over, the weather, and the diversity in cultures. It's a place to live where your family is a welcomed part of the community. As you walk to the hospital up Vancouver Street from the old Milton Horse watering station, you will walk by Construction in Progress. The future credit union place is generously being built by Coastal Financial Credit Union to help house medical students and residents in our Dalhousie Family Medicine Residency program, conveniently located a very short walk to the hospital doors. Our hospital is placed on a hill at the end of our harbor and has some of the best views in town. There is a nice area around it to enjoy the view and take a little walk down to the gazebo of Beacon of Light Park. Nestled next to the hospital is the Yarmouth campus of the Dalhousie nursing program, which adds depth to our educational environment and keeps an excellent supply of newly trained nurses on the most recent curriculum. In addition to the Dalhousie registered nurse program, our Nova Scotia Community College Burridge campus has an excellent and well-attended 2-year licensed practical nurse program, further adding to a base of well-trained local nursing staff. Our lobby is bright and spacious, leading off to admissions, emergency, dialysis, and our lab collection hub, to list a few. We have a long history of being well supported by our community, and donors are visibly recognized here. Our tour today will look at a few of our key departments and a brief visit with our residency program. So let's head to the emergency department.
My name is Sean Davis. I'm a family physician in Yarmouth. I'm a CCFP physician. So this is a regional emergency department, so it sees reasonable volumes. We saw in 2019, before COVID, about 31,000 visits for the year, and that averages out to about 85 visits per day. There's a wide range of presentations here because it is the regional. Things tend to kind of funnel in here from Digby and Shelburne. We see anything from your basic boo-boos and and cold and cough and cold symptoms, anything up to major trauma, heart attacks, MIs, strokes. All of that will come here because we have the advanced imaging and the specialists to deal with it. We have about a dozen physicians in the group, very cohesive group. Everybody works really well together. They're just a nice bunch to work with. So in terms of shift work and shift lengths, we actually have a fairly wide variety, and that continues to be kind of tinkered with over time, especially the time that I've been here. Night shifts are typically 12 hours, but day shifts are usually double coverage, and that double coverage can run anywhere from 6 to 8 hours. So for day shifts, you'll see a mix of 6, 8, 10 and 12-hour shifts, just depending on how many people are available and what people want to do. So there is a fair amount of flexibility in the shifting of the week, which is kind of a nice thing as well. other services that we work with. So we have internal medicine that we work with, general surgery, ophthalmology. We have ENT and obstetrics gynecologists. You do end up having a fair amount of autonomy and having to take care of things for longer periods of time. So if you get sick people, it's especially in the winter and during kind of more inclement weather, it can be difficult to get them out. So it provides you a little bit more experience with taking care of people for longer times. It's a kind of a nice medical challenge to be able to take care of people for long periods of time in contact, of course, with Halifax specialists, and making sure that they get the care they need before they can get into specialist hands.
Hi there, I'm Brian Moses. I'm an internal medicine specialist here at Yarmouth Regional Hospital. I've been working here for about 12 or 13 years. Was formerly the chief of staff and site medical lead here, and currently the lead for internal medicine. So Yarmouth Hospital has an inpatient unit that covers about 100 beds. That includes a 7-bed intensive care unit, as well as medical and surgical floors, some floors that are mainly designated as alternative level of care spaces for patients awaiting nursing home, and some psychiatry inpatient beds. For people who are doing inpatient work, the hospitalists cover a service that is usually 18 to 20 patients. That is a mix of acute patients and patients awaiting long-term care. We have 4 streams of hospitalists, so at any given time there would usually be 4 family doctors doing hospitalist at the same time, as well as a half stream that's covered by the internal medicine service of the more acute patients. We have, as mentioned, a 7-bed intensive care unit, which is managed by mostly the internal medicine service, but we have a surgeon who also covers in the intensive care unit. It's a closed ICU covered for a week at a time, so any support required for those inpatient beds as far as intensive care would be covered by the intensivist on for that week. The hospital has a great collegiality amongst both physician staff and nursing and allied health staff. I've never worked anywhere before where there's been such a good relationship between all of the people working, and that includes people on inpatient units, people between different specialties, including diagnostic imaging, who we rely on, of course, for inpatient management of our patients. So because of our geographic location, we do offer some services that would not be offered in most places in Nova Scotia, and certainly not most places of our size. One of those is our dialysis unit. So we have a fully serviced dialysis unit here in Yarmouth, and also we oversee satellite dialysis. There's one that's about to open in Digby at any point. So because of that dialysis presence here, not only do we have patients coming from fair distances who receive their dialysis treatments here, but we also serve as a level 2 ICU for our region. So patients who are sick and require inpatient emergent dialysis, for example, somebody who has septic shock and multi-organ dysfunction syndrome, might be transferred from Bridgewater or Kentville here rather than Halifax because of our capability to provide dialysis. So it does mean our intensive care level is higher than all except for metro area hospitals and Sydney and Cape Breton.
Hi, I'm Dr. Michelle Ong. I'm one of the radiologists here at Yarmouth Hospital. For diagnostic imaging, we offer a really broad range of services, which pretty much covers everything. So from CT to MRI to ultrasound, X-ray, nuclear medicine, echo, bone mineral densities, breast services. We have screening and diagnostic breast mammography. We actually do breast MRI also, and MRI breast biopsies. The CT is good. It's got CT fluoro capability, which helps us for interventional radiology. The MRI magnet is a 1.5 Tesla magnet, it's a pretty good workhorse. It's only very few specialized kind of things that will end up going to Halifax, such as maybe PET CT, which that would be the only center, but otherwise everything else we have available over here.
Hi, I'm Dr. Carmen Murphy. I'm a family physician, and I've worked at Yarmouth for 12 years now. I'm going to talk to you today about the Oncology Unit. I've been working in oncology as a GPO, or general practitioner in oncology, since we moved to Yarmouth. I'm also a family physician. That's my training background. We moved here because of my husband's family is all here. But we've stayed because of the collegiality of the hospital. The nursing staff are great to work with. The other physicians are great to work with. As a family doctor, many of us have worked in places where people have found specialists to be cranky or dismissive when you're trying to do a consultation. And I haven't had that experience here. It's been, on the whole, a really positive experience. And we just recognize that that's not always easy to come by. So our oncology unit is actually a fairly large unit for a regional hospital, and that's largely because of our distance from Halifax. So in order to save our patients from traveling so much, we end up doing a lot of different care. Basically, the only systemic treatment that we don't offer would be, by and large, inpatient treatment, but any of the immunotherapies or chemotherapies, otherwise we pretty much offer in our chemotherapy unit here. We have 2 physicians, including myself, who share a full-time practice essentially here. And we also have 3 medical oncologists who take turns coming down to see their patients here. So between those 3, we actually have covered most of the cancer sites. We also have a couple of radiation oncologists who do telehealth, and our medical oncologists do telehealth. So in the in-between times when they're not down, they sometimes will see patients that way. I think the most important thing about our unit is that our patients are going through a very hard time in their lives, and they really appreciate that we can make it easier for them by avoiding the travel to the city all the time. And I've found that patients are very thankful for that. And now we're in Prenatal Clinic. I also work over here. So Prenatal Clinic, it was built around 20 years ago and is a collaborative practice. Currently we have 6 family physicians working in Prenatal Clinic, and we take turns doing call and looking after Prenatal Clinic on our call days. We deliver basically all of the babies who come to Yarmouth Regional Hospital to be delivered, although we do have obstetrical support, we have anesthesia support, and much of the time we have pediatric support. We also have a full-time nurse here, so generally the nurse will see our prenatal patients first, and then we'll go ahead and see the patient. So the education piece of prenatal care is done largely by the nurse, and that's really helpful for us. They're also very good at making sure that everything gets taken care of. So we pride ourselves on providing very good prenatal care, and our reviews from the reproductive care program are always very good. We have about 300 deliveries a year. We do the primary care as well as the newborn care, as well as the postpartum care for all those mothers and babies during their pregnancies. We also have a nurse practitioner down the hall from us who provides well woman care and baby care up to 6 months, as well as a lactation consultant. One thing that I've always loved about our prenatal group is that our group of doctors is very easygoing and we get along really well. Making the schedule is surprisingly always easy. There's a lot of give and take, and if you're brand new and you feel like you need backup on one of your call nights, one of the rest of us will always come in to give you a hand.
Hi, my name is Abir Hussain. I am the site director of the Southwest Nova Family Medicine Residency Program.
Hi, my name is Melissa Power. I'm a PGY1 in Family Medicine at the Southwest Nova site.
Southwest Nova Residency Program was established in 2014. We accept 5 family medicine residents each year. The Southwest Nova Family Medicine Program is a longitudinal integrated program where family medicine residents practice comprehensive family medicine in a rural setting.
So I really wanted to come to the Southwest Nova site because of the longitudinal curriculum and the ability to do something different every day in my training, whether it's a family medicine clinic one day, psychiatry the next day, and emergency medicine another day. It's quite a variety, and it would help solidify my learning by being able to adapt to changing patient population every day and carry those skills forward each and every day that I came to work.
The family medicine resident attends family medicine clinic twice a week or 3 times a week. And on other days, they attend different specialty disciplines. They do most of their training mainly at the Yarmouth Regional Hospital, where there is an academic center, a teaching classroom, a simulation lab.
What I enjoy about this program is there's a great continuity of care with patients as well. For example, I may see a patient in the emergency department and refer them to the local geriatrician, and in a couple months' time I may be working with that geriatrician and actually get to see that patient again and see what kind of management plan that physician put in place and get that continuity of care to really solidify my learning in this environment.
What I really like about working at Yarmouth Regional Hospital is the collegial environment and the very friendly medical community here. There is great support to physicians and to learners all the time. It's very easy to build connections and relationships with other colleagues, consultants, healthcare providers. And that really creates a great support for the physician and the learner as well. There are great teaching opportunities in Southwest Nova. All disciplines are involved in teaching the family medicine residents.
As a resident, I enjoy the opportunity to teach medical students, and there are lots of medical students that come down to Southwest Nova during their electives, and this is a great opportunity for me to hone these teaching skills. I also quite enjoy learning from all the different specialties. They provide great one-on-one teaching that is very valuable to my residency training.
There are multiple opportunities for teaching in emergency room, in family medicine, in internal medicine, and all other specialties.
The sum of all of our parts is striving to create an excellent, well-equipped facility to practice medicine in. Contributing to this are the Hospital Foundation, our family medicine residency program, and our smaller community clinics in Yarmouth, Pubnico, Barrington, and Clare. The opportunity for a bilingual practice in Pubnico and Clare is not common in Nova Scotia, but being bilingual in English and French is also not required, as English is the primary language. Now, let's meet some of the staff.
My name is Matthew Stanwood. I'm a physiotherapist with Rehab Services. Welcome to our virtual tour of the department. To explain a little bit about our department, we are a medium-large size department. We have about 27 staff at present with us. So that's divided up between physiotherapy, occupational therapy, and recreation therapy, as well as a whole host of rehab assistants that help us accomplish all the good work that we do here. We provide all sorts of services. So we have a full outpatient department here. You can kind of see some of our stuff in the background here. We provide everything from exercise groups, whether it's waiting hip and knee surgery, you have just had a heart attack, so cardiac rehab, pulmonary rehab, so perhaps COPD, that kind of thing, as well as a whole host of general outpatient referrals. We provide a fair bit on inpatients as well, so we definitely have a philosophy of trying to get patients up early, mobilized, really to minimize the amount of time that they spend in the hospital here. We have what's called the Mobility Enhancement Program. So this was something that was actually recognized by Accreditation Canada as being a leading innovative practice. We follow the same philosophy of early mobilization, ensuring frequent care by the team to continue mobilizing patients, getting them up, getting them moving. And it sort of highlights some of the innovative thinking that we have down here. So any areas that we recognize as having a gap in service, it's part of our department motto to try to fulfill those and provide the best quality care we can with the resources that we have available here.
The partnership between our community and our regional healthcare facility is evident in so many ways, from our park on hospital grounds, a commitment to making a better housing experience for medical learners, and the steadfast dedication of our hospital foundation.
Hi, I'm Paulette Sweeney Goodwin, Managing Director for the Yarmouth Hospital Foundation. We work year after year to support and enhance our hospital as a community and regional center of excellence in healthcare. And a big part of what we do, and when we go out there and raise money after the priorities are identified to the foundation, we set about raising monies to purchase the equipment that has been indicated that's needed for our hospital here. And of course, that equipment helps with all medical professionals and physicians coming in to do their work. Examples of commitments that have been fulfilled are things like laparoscopic suites, working with providing what's needed when possible for the OR. We touch on dialysis. We touch on pharmacy. There's not an area of the hospital that the foundation has not supported. So we're very pleased working with our communities, our donors, our sponsors, our volunteers, that we're able to provide what's needed for our hospital. And of course, we never lose sight of the fact that the Yarmouth Regional Hospital serves Digby, Shelburne, and Yarmouth counties.
I'm Harold Cook. I'm chair of the Yarmouth Hospital Foundation Board and Executive, and I'm pleased to participate in what is an amazing support for our hospital through the generous donors of the region. We've been so fortunate over the years to have people pull in so generously behind our leadership to bring improvements to the hospital, particularly through equipment and things that can be advanced in the hospital itself. The residents of this area have been more than generous. For example, just in our recent radiothon, we raised over $182,000 in one day on air, and that's just an example of the generosity of people of the Tri-Counties. We are always looking forward to doing more, and we fully anticipate that there will be resources to do that as we move into the future. This does try to raise our regional hospital to the top level that it can be by enhancing healthcare delivery. That's our prime objective.
I've enjoyed touring our hospital with you and welcome any further inquiries you have.